Welcome to another episode of the Dental Insiders with your hosts, Matthew Petchel and Michael Dunn. The Dental Insiders is a podcast for dentists, dental team members, and industry professionals. We'll share stories and lessons from clinicians and industry visionaries with the goal of providing an entertaining and informative look at the industry we share. And our guest today is Dr. Darin O'Bryan.
D-O-B in the house.
Yes, as the kids would say.
Yeah, like D-D-O-B or D-D-S,
Yeah.
D-O-B.
Yeah. Luckily, he's still with us. Good morning, Darin. How are you?
Good morning. How are you?
Doing well. You know what? You want to just get right to it?
I think we should jump right into it.
Yeah. So, Dr. O'Bryan, we know you're a busy guy. Give us a profile about your practice. Operatory staff, technologies, that sort of thing.
Okay. So I live in a small town on the coast of Oregon, about 22,000 people, a little town called Coos Bay. It's actually two towns together. Coos Bay, North Bend is the actual municipality. I have 5 operatories. I have 2 assistants, 2 hygiene, 2 front desk. My office manager, who is also my wife. As far as technology goes, I have pretty much all the toys you could possibly imagine. I have CEREC, I have Galileos for 3D imaging for implants. I have the Lanap laser from Millennium for periodontal therapy. I've got diode lasers, SHIC 33 sensors. I pretty much have all the little gizmos and gadgets you could actually want.
Cool.
And was that your plan from the start? Like when you were getting going, did you say, all right, I know more than anything, I'm going to start this practice. I'm just going to go buy the best stuff no matter what. I'm going to be that high-tech dentist. Or was it something you kind of learned along the way?
Actually, I kind of fell into the whole CEREC thing. I moved here in 2004 from Minneapolis, St. Paul. I went to the University of Minnesota Dental School, graduated, worked for a large group practice there for about 7 years, became a partner in that group. But they started talking about some venture capitalists coming in. It was heading the corporate way, and I wasn't real thrilled about that concept. I was looking for more of a small town kind of feel to my practice, even in the big city. I worked in a small neighborhood in Minneapolis and still had that small town kind of feel to my practice, even though I was in the heart of downtown Minneapolis almost. So I moved out to the boonies. When my parents retired out here, I kind of looked at the area and took a look at the demographics of the patients and the doctors that were here and how many were going to be retiring in the next couple of years. And it looked like a really great spot to get set up then. Moved here in 2004 and started having some trouble with the laboratories at that time. I couldn't find a good lab that I really wanted to utilize. I asked my Patterson territory rep, said, do you know any of the good labs here? I'd like to work with a local one if I can, at least here in the state, if not in town. And he said, have you looked at CEREC? And that got me started down the technology path. And once I kind of got bitten there, it went whole hog. Once I did that, I started doing my implant training about the same time. That got me interested in 3D. And since I already had the CEREC, it made sense to go with the Galileos at that point. That got me down the technology path. And it sort of just blossomed from there to where every time I started looking at new technologies, I would find out things through people that I know in the industry and which ones really were going to fit the model of practice that I had. So I started out in an old office that was kind of nasty. We had a 1970s burnt orange Panorex that you sat down in and pink Pelton Crane chairs from, I think, before I was born. And then we started revamping that with newer ADEC quality chairs and just started updating it slowly over the course of a couple of years to where we did a build out in our new office in 2012, where we just got into our new facility and built out the new, really state-of-the-art looking office for all the technology that I had in my old little POS office.
Did you have shag carpet in that office?
Yes, actually we did in the break room.
Yes.
We had shag carpeting and some 70s floor tiling that was really, really pretty.
So at least the decor and the equipment, there was a cohesive theme.
Yeah. Were there any fish alive in the fish tank, or was it just mossy,
just
floating?
Yeah, sort of the Scuds pond really is what it was.
Yeah. So let's back up a little bit, though. We're going to talk about technology, I think, later, but let's back up because, is being a dentist something you always wanted to do? Or you like, I can't remember that Christmas cartoon, the kid in the Mist Toys. Yeah. Were you like Hermie?
The elf that wanted to be a dentist?
Yeah. Were you like Hermie?
I wasn't building toys, but I wanted to be a dentist since I was in 9th grade. That's when I kind of decided I wanted to be a dentist. Nobody in my, and everybody was asking, was your dad a dentist? Was there somebody in the family? There really wasn't. My dentist when I was a kid was this sort of outgoing guy. He showed up to work on his Harley Davidson wearing a tie-dyed shirt and sandals. And I looked at that and went, that's the kind of job I can do, that I have the control over my life to be able to roll up on my motorcycle and Birkenstocks if I want to. Not that I wear Birkenstocks.
Right.
But
So what was
that would be a stereotype living in the Pacific Northwest.
Right.
We're not about that.
Birkenstocks and wool socks.
Is that a box of granola behind you?
Yes.
Are you going hiking later?
So your hippie dentist wasn't Paul Forstein, was it?
No, it wasn't, but it was very similar. Very similar feel.
Yeah. So ninth grade, you got your life all planned out. You're gonna be a dentist.
Pretty much. I went to the University of Minnesota Dental School. I knew as soon as I got there, I visited the dental school and I asked them, what do I need to do to become a dentist? And they gave me the fast track plan. And then I took enough classes, got the grades I needed. I actually got in 3 years. I don't have an undergraduate degree. So if I'm not a dentist, I'm pretty much screwed because I have no bachelor's degree whatsoever. I have only one marketable skill, and that's dentistry. So if I'm not doing dentistry, I'm pretty much panhandling, or I'm a bartender. That's about it.
Yeah. Well, that might be an interesting path, though, because now you're stuck in this in a good way, right? You're like, you know what? This is what I'm in for. I don't really have any other options.
The interesting path of being stuck.
Having
no other options.
It's great motivation, right?
Yeah, it forces you to get up every day and go put your fingers
and go
in
do the
people's
one
mouths.
thing that you know how to do. It's not like Darin wakes up and goes, oh, maybe today I'll be a scientist, or tomorrow I'll be an astronaut, or today I'll go be a fireman. I don't have any of that training.
I don't have a generic degree that I can go do anything. I'm pretty much set with one pathway, and that's pretty much it.
I didn't know you could do that.
I didn't either.
I honestly didn't know that. You could just skip
you could fast track
undergrad and go right. So you went right from high school into
No, I did 3 years. I did 3 years of undergraduate.
So you went to the dental school and said, look, I'm going to be a dentist. That's all there is to it. What do I need to do? And they said, well, here's the prerequisite courses you need to get into dental school. You took the courses, got into dental school, and kept rolling.
Not every dental school has an early admissions program. The University of Minnesota did.
Got it.
And it was basically set up where you had to do a certain number of credits, get a certain grade point average, and get good enough DAT scores to get in. If you could meet those requirements, typically you were going to be able to. Because the grade, they said the GPA was like a 3.0. You had to be well over a 3.5 to even be considered for early admissions.
Oh, wow.
And you had at least 2 sciences every quarter to make sure you could handle the workload of dental school, because there's no one class in dental school that's that hard. It's the sheer quantity of them that's just absolutely oppressive.
Right. So now we fast forward. You've fast tracked. You've practiced in the group practice. You move out to the Coos Bay, North Bend metropolitan area, I guess, as the residents call it. You're practicing in this kind of small town, or the convergence of these two smaller areas. Other than avoiding Bigfoot, what challenges are there in practicing in a rural area?
You laugh about Bigfoot. I was driving home last night, and there was a bumper sticker on the back of one of the trucks said "going squatching," which is the actual term for when you're out hunting Bigfoot.
And is that a business? There are some parts of the country where that's like a big tourism.
Yeah, absolutely. There is a tourist industry in the Pacific Northwest to go looking for Bigfoot.
The Coos Bay, North Bend metropolitan area is one of the hotbeds of squatching.
Yes. I would not take the metropolitan area because so my office is right next to the hospital in the middle of town, but there's a river, a creek that runs up, and so there's this woodland path kind of that goes up. And I've had elk in my parking lot in the morning. We had a cougar that killed a deer, and we could see where it killed it and drug it off. And it was I could hit it with a rock from my office if I wanted to. And I don't have a very good arm, so it wasn't that far away. Wow. So I do actually live in a rural enough area that I have cougar in the backyard of my practice and my house at times.
So one of the challenges is really getting to work without being slaughtered.
Yeah. It is. Exactly. I'm actually lower on the food chain now than I ever have been.
Yeah.
Most people get up, they have to get their coffee, get their kids to school. I actually have to run for my life.
Squatchingforcougars.com. That could be
a different site.
It could be. Yeah. So it's an interesting question. Is being a dentist hard? Is it hard work? Is being a dentist hard?
Yeah, it can be. It can be very hard.
Yeah.
Especially if you don't love what you do. It can be very repetitive. If you don't make it engaging and make it interesting for yourself, if all you do is follow the path of I'm going to fix this tooth and it's going to break down eventually. We know it's going to break down because nothing we do is going to replace what nature gave us. We're really trying to repair damage the patient does. And patients are amazingly able to destroy anything that we do, no matter how good it is. They will screw it up somehow.
That's their job.
That's their job. Exactly.
Really.
They wouldn't have a job.
That's right.
So it's difficult in that regard. Also, if you look at most dentists, they are also the revenue stream. If I own a grocery store or I own an auto mechanic shop, unless I'm doing the actual work, usually I have employees that are making most of the money, and I'm really just managing the business side of it. Most dentists, if you look at hygiene, they're not making a ton off of hygiene, certainly not enough to live. They're even in some practices, hygiene can be a loss leader if they're not careful. So now they're really only making money when their hands are touching somebody's teeth. So at that point, they're not only running a business, they're also the main revenue stream of that business. It's a fluctuant business. You ask any dentist, there's certain months that just suck. And you're sitting there going, I'm literally sitting around doing nothing. And as I'm paying all these people. So it's stressful from that regard, and not only are you having to do the business, you're having to manage the business. Plus everybody that walks in your door hates you right off the bat. I've thought about just going into the bank one day and just going, God, I hate being here. Nothing personal. I don't hate you. I just hate being here. How can you do this all day? This is a disgusting job. Start treating everybody else in the world the way they actually treat us. It would be actually kind of fun to do, just like a social experiment to see how people react.
Yeah.
If we acted towards them the way everybody does coming into our offices, and that can wear and tear on people.
Sure.
There's a psychological component to dentistry where you just get beaten down every day from people hating being in your office.
We get that from a lot of our guests here on the Dental Insiders. God, we hate being here.
I sense we're getting it right now.
Yeah.
Why am I here? Why
am I here?
Why am I okay to do this?
Yeah, you guys are this is disgusting.
Maybe that starts, maybe a sign needs to go on the door, right? The very first, I'm half kidding and I'm half serious.
Yeah.
It's almost like you're entering, maybe the sign should just say, we know you don't want to be here.
Yeah, check your attitude at the door.
But we're still here. We're still here for you.
Yeah. Be nice or we won't be.
Exactly. Yeah, be nice or it's going to hurt more.
Yeah, I mean,
I had a patient I worked on. I did a crown on her. It went very smooth. I sit her up and I go, that wasn't too bad, was it? She goes, well, it wasn't that bad except for the fact that I felt like I got waterboarded. And I'm like, seriously? I can go get a bucket and we can see if it's actually the same.
Yeah, we can make it worse. Yeah, let's try the camera. We'll do it.
That's exactly what I said to her. I said, imagine how bad it is. I'm actually trying to help you right now. Think of what it would be like if I wasn't. I mean, I'm doing everything possible to make this as comfortable as I can.
Yeah, you're a patient I kind of like.
That's right.
Yeah, I kind of like you.
Yeah.
It's a good thing you paid your bill. I mean, can you imagine what it would be if you didn't?
Yeah.
Right. So
you didn't. She didn't see the plaque on the wall that says you did your residency at Guantanamo Bay, right? Is that what?
Never saw that part of it. She doesn't know that I actually secretly work for the CIA on the side, questioning people.
But to take it to a serious level, a little serious. I mean, you mentioned it's hard, it's stressful, and you pointed out that you're not just the business person and the vision behind the practice, but you're also the production element. Right. So how do you? And we talked earlier about you're locked into this with your track to dentistry, but how do you stay inspired and get up every day and deal with those patients and do it day in and day out?
There's a couple things. The thing with dentistry is it's like any part of life. We remember the negatives more than we remember the positives. We remember the patient that bitches about things. We remember the patient who says they got waterboarded. But then, I've got a wall of fame that I have up on my thing. And it's letters from patients of either pro bono work that I've done, smile makeovers that I've done. Sometimes it's a single tooth. I have a great letter up on the board that is from a patient who had been to we have an Indian tribal clinic here, and they refer patients over to me for some of the more advanced procedures. And she came over for, I don't remember what it was. I think it was an extraction. And she had a single front tooth that was almost pitch black. She'd had a root canal on it. It got dark. She never knew it could look like the rest of her teeth. So I fixed that one tooth for her one afternoon. And she wrote this wonderful letter about how much it's changed her ability to feel confident and smile and things like that. So that's part of what helps me get through my day, is those patients that truly do appreciate what we do. They come in pain, we fix it. They've had bad experiences in the past. We do a one visit crown on them with CEREC, and all of a sudden they're like, wow, that's amazing. they're excited about it finally. And one of our mission statements that we started off was trying to change people's perspectives in dentistry, whether that's at a community level, an industry level, or a per patient level. By changing the way they view dentistry, that makes me go, okay, that person now has a better view of what we do. And that's a huge part of it. I also stay engaged through online forums and things of that nature through my teaching, and that helps me also stay engaged in dentistry and motivated to do things. Because if I run into a problem, I'm not just here all by myself in the middle of nowhere. I've connected through online forums so that I have kind of a support network. I have a support group that says, hey, we've all been there, and it'll get better.
Right.
Yeah. And I look at some of the questions here that I have for you, and we want to talk about technology. We want to talk about education and learning. So this is definitely going to be a two-parter.
It's a two-parter.
And I think this wraps it up for part one.
I think it does.
Yeah.
So thanks for, be sure to join us for part 2 of our interview with Dr. Darin O'Bryan. And thanks for joining us, Darin.
Thank you.